Hello everyone, it's a girl Millie. In this day and age, we are encouraged to identify a problem and create a solution for it. And that's exactly what I did. I came across this post and I thought of designing a set of digital forms to help in the continuity of medical care. Since it's a level 6 facility, we expect patients from neighboring counties and beyond. To accommodate this, I designed a digital registration form that includes a drop-down list of all the 47 counties, ensuring each and every patient's origin is properly captured for both planning and research purposes. So we shall start with the registration form, which captures all the patient details and automatically generates a unique patient code. So the only thing you need to have is an Android phone. Go to Play Store, download Combo, collect all ODK. Then with the shared QR code, you get to access the forms. So click on Start New Form. Click on Registration. Junguna will be HRIO. The registration date is auto-populated. Then consenting is a must. For this case, Kisumu will be a county. Then Kisumu Central at the district. As you can see, there is a patient code which is being auto-populated. Patient name Atieno. Location will be Kisumu. Gender will be female. Then date of birth will be 2020. As you can see, the age is being auto-calculated. Next, single. So telephone number must be a 10-digit number. Then if it's a minor, you'll have to use the guardian's phone number. If the patient has an insurance, select yes. If no, you select no. So if yes, you have to specify. For this case, it's a no. Then finalize it and send it. So okay, head back, refresh the form. So the next one will be the consultation form, which is used by the clinician to access patient's ENT condition and determine their surgical eligibility. So click on the form. Next, consenting is a must. Patient code was so you must key in the code that was generated. So KAC 8737. So as you can see, the data has been auto-populated. So blood pressure will be 120, 80, 5.6 as the blood sugar. If the patient has any medication, click on yes and specify. For this case, no. So any active infection, if yes, select yes and specify. For this case, no. Hemoglobin level, he or she was tested, click yes if she was tested and key in the figure. For this case, no. So had the patient undergone ENT surgery? If yes, you key in yes and specify the details of the hospital and the year. For this case, no. Any other medication? If yes, and specify. For this case, no. If the patient experiencing any ear pain? If yes, click yes and specify. For this case, no. Any ear discharge? If yes, click yes and for this case, no. So side affected, for this case I'll select both. The loss will be mixed. Then this will be I know. So dizziness, if it's a yes, you'll also have to specify. For this case, no. Nasal obstruction, if it's a yes, you'll also have to specify. For this case, no. Difficulties in swallowing, if yes, you'll have to specify. For this case, no. Clinical diagnosis, demonstration purposes will be a hearing problem. So is it surgically correctable? For this case, yes. Then fit for surgery, yes. So next, and consenting must be done. For a minor, you have to consent to the guardian. For this case will be Jane. Appointment date will be 31st, and doctor's name will be Mary. Finalize it, then send it. Then once you're done, head back, refresh your forms. So we have the final form, which is the surgery form, which auto-populates data from the previous forms, allowing the surgeon to record the procedure details, outcomes, and any complications. So click on it. Consent is mandatory. So the patient code was KAC 8737. So as you can see, the data has been auto-populated. So next, so surgery performed is also auto-populated. So anesthesia administered, yes. So type of surgery, you'll have to select one. So surgery note, surgery was successful. So complication for this EVS, you'll have to give the details. For this, it's no. So follow-up required, yes. So will be on a monthly basis. So on a monthly basis, follow-up. So surgeon will be melee, then finalize it and send it. So yeah, and we are done. As you have seen, all the forms are interconnected through the patient's unique code, ensuring that data consistency, continuity of care, and accurate records. This setup, it helps in the support of evidence-based research and enhancing data-driven healthcare delivery. So innovation doesn't always mean inventing something new. Sometimes it's about improving what is already there. Thank you for watching, and if you're interested, you can holler me up at 0783 115